Hello friends, this is Dr. Arun Panda, facial plastic surgeon, Mumbai. So let's get on to the next episode of Demystifying Your Facial Aesthetic Concerns, wherein we try and explain you scientifically about the common problems about your facial aesthetics on the day-to-day life. So during this lock time, a lot of our patients are complaining of flare-ups on the facial skin. So that's going to be very drastic of what people think, that we are at home and why there are flare-ups during this time of lockdown. We are not even going out into the sun. Okay, let's try and understand why there is going to be some flare-ups when you are sitting at home during this lockdown period. So the first and the most important cause of that is basically the stress. What actually happening is basically we are sitting at home, we are all thinking about our EMIs, we are thinking about the kids, their 10th standard exams, board exams, and a lot of other stuffs. When are you going to start working and stuff? This is causing a lot of stress in our mind. So what exactly stress does is basically it releases or increases the production of cortisol in our body. Now what cortisol does is basically it reduces the level of estrogens, and this estrogen levels, when they come down, the androgenic hormone, they start going up, and this androgenic hormones, what they do is they start working on the sebaceous gland and they start producing a lot of sebum. Now this sebum actually is the culprit which causes the acne. So how do we handle it? And you have to do meditation, do prayings and all those things to reduce your stress levels. Okay, coming to the second point and the second important thing, what causes this flare-ups during this lockout time is moms, you guys are all watching YouTubes and preparing a lot of foods, nice yummy food, but the problem is the diet. The diet is a very important thing which is causing this flare-ups. Now, a lot of researchers has proved that dietary products, ice creams, yogurts, milk, and a lot of sugary and food with high glycemic index, carbohydrates, sugar, you guys are making jalebis and cakes and stuff like that. So these actually they trigger the acne eruptions on your face. Now, what should we consume then? So we should be consuming more of the cereals, fruits, unprocessed food, fruits, vegetables, meat, egg and other stuff which is non-comedogenic. The other thing which I would like to tell you is the fluid consumption. I think we are all reduced our fluid consumption sitting at home, we are sitting in the AC, but it's very important for us to replenish the fluids in our body. So diet, yes, it's a very important thing. There are a lot of research which says that we have been talking about chocolates, fried food and junk food, they cause acne eruptions, but researchers have shown that of course they are not good for your health, but they do not have any impact on the acne eruptions per se. The third thing which is important is basically it's called as an occasional acne. We are all playing around with our circadian rhythm. So now what's happening is we are supposed to sleep at a particular point, a time, and we're supposed to get up at some time. Now what's happening is throughout the night we're watching Netflix and we are getting up late in the morning. So we're actually disturbing the whole circadian rhythm. So because of that, our body is producing a lot of cortisol, and as I mentioned earlier, the cortisol actually is kind of producing a lot of this androgenic hormones which are working on the sebaceous gland, and it is actually causing a lot of acne eruptions there. So what should we do? People have also said that when you are having a disturbed sleep and you are playing around with your circadian rhythm, so it is also deteriorating your immunity. So the best thing to do is basically sleep in time, get up in time, and that's going to kind of regularize your rhythm, and that's going to help you in preventing of course it is going to improve on the immunity, and of course it is kind of helping you in having a clearer facial skin without any acne eruptions and things like that. So these are a few important points which is actually kind of creating a lot of havocs and patients who are kind of talking about having eruptions during this lockdown period. In our future videos we'll be discussing more about acne, the causes of acne, what medicines can we take, how to evaluate them. You should always visit your physician and things like that. Keep watching my videos if you'd like to know more about your facial aesthetic concerns, and if you want any specific question to be answered, just write us on the emails which has been provided, and we'll be more than happy to answer you. Thank you.